Hello, I'm Wu Yue from Institute of Biophysics, Chinese Academy of Sciences. I'm a first-year PhD student. My presentation title is Findings of Vascular Changes in Small Vessel Disease at 7 Tesla. Small vessel disease is the most common aging brain problem. CADASIL is the most common hereditary cerebral small vessel disease caused by mutation of NOTCH3 gene. It provides a good model to study SVD. Accumulating evidence has demonstrated clinical changes in CADASIL patients, including small arterial damage, hemodynamic change, and cerebral hypoperfusion. At ultra-high field imaging, higher SNR, enhanced inflow effect, and improved susceptibility effect will benefit the sequence like TOF and SWI. Here, we aim to analyze vascular changes, including small arteries and cortical veins, in patients with CADASIL using 7 Tesla MRI. We enrolled 41 patients and 41 sex and age-matched healthy controls. We use Siemens 7 Tesla MRI system and 32-channel Nova coil. The protocol included T1 MP reach, T2 flare, TOF, and SWI. For the study of LSAs, 3D TOF-MRA was used to directly measure the number of branches, length of LSAs, and the proportion of discontinuous LSAs. For the study of cortical veins, quantitative susceptibility maps were reconstructed. Freehand ROIs were drawn to evaluate average cortical venous susceptibility. Here are some brief results. For LSAs, we observed a decrease in the number of LSA branches and an increase in the proportion of discontinuous LSAs. There was a positive association between the number of LSA branches and the Mini-Mental State Examination scores of CADASIL patients. For cortical veins, we found that venous susceptibility increased with age and was higher in the CADASIL patients compared with the healthy controls. Furthermore, we found positive association between venous susceptibility and MRI lesion load and the clinical phenotypes in patients with CADASIL. In conclusion, high-resolution TOF-MRA at 7 Tesla reveals small arterial damage, especially in the basal ganglia area in CADASIL patients. Susceptibility-weighted imaging and mapping revealed decreased venous oxygen saturation, suggesting hypoperfusion in the brain tissue. Together, these findings prove that 7 Tesla MRI is a promising method to assess the vascular change of patients with SVD. Thank you.